Constipation is common in first trimester, but there's something I do. I like to take cucumbers, but if you're finding it difficult to digest them, especially the back of the cucumber, which is a little bit harder, you can actually peel it off, but make a smoothie or a juice or whatever. Eat it just like that. Fingers are finished with counting. Hey, so if you are watching this video, then you're definitely in week 10, or you just want to know what happens in week 10. Wow, congratulations for making it thus far. So week 10 is the period where you start giving your breast some good attention. Why? Because your breast is supposed to be responsible for feeding your baby when your baby comes out. We all know that, don't we? So your breast will be taken over from the placenta once your baby comes out. So around week 10, your breast keeps getting enlarged. And this is the reason why you should be taking care of your breast in this period. So week 10 is in the 3rd month of your pregnancy. So you still have about 6 months to go. At this stage, your breast becomes harder and darker with some little lumps around it, which is called the Montgomery tubercles. Your breast will still feel tender and swollen as you progress through pregnancy. Your breast ducts are beginning to develop for the role which is supposed to play as far as breastfeeding your baby is concerned. And you know what I mean when I say it enlarges to accommodate milk. It's going to stretch. Your breast is going to stretch. Imagine pouring some water into a plastic bag and how it stretches. That's exactly what happens. So those of us who are still concerned about our breast remaining pecky, this is the point where reality sets in. How to give your breast some good support. Listen and listen good, mommies. There are no muscles in your breast. Your breast is only supported, or the weight of your breast is supported by elastic ligaments that can stretch. And when they stretch, they don't come back. Even though there are some exercises you can do to, put some muscles around your breast area, it can only help to support your breast a little bit. But once the breast is gone, it's gone. So darling, when your breast gets bigger and heavier, get a bigger bra to support your breasts. There are some people who think after giving birth that their breast will go back to what it was before. Fine, there are people who are gifted with so much elastin in their body that they won't suffer. Do I call it suffering? No, it's one of the signs of being a mother. It's one of the signs of being a mother. So there are people who feel when they give birth, their breast shouldn't lose its elasticity. It shouldn't lose its peckiness and all that. But please, this is reality. There's no bone in your breast. There's no muscle in your breast. It's just ligaments, and when it stretches, it doesn't come back. So don't go killing yourself about it. Well, there are people who can actually afford plastic surgery to kind of like give themselves this, I look beautiful, my breast is still intact and all that. But when you get old, are you going to be looking different from your breast? Who is looking at your breast? So my dear, if you are somebody who has given birth and have given birth to lots of children, if your breast is still pecky, it can be pecky. It can be pecky to some extent, yes. But if your breast can be a little pecky, good for you. But if it is not, hey, people are different. Your hormones react differently. Your personality is different. You have to embrace yourself. Your beauty starts from here before it comes here. So you're as beautiful as you feel in here. There are ways that you can reduce breast sagging. If it's going to sag, yes, it will, but you can reduce it. And so you can reduce breast sagging if you start early. That's why it's advisable for people to wear their bras. Make your bra as comfortable as possible. Well, some people will say things like, don't sleep with your bra. When you sleep with your bra, it can cut your circulation. It can do this, it can do that. Please get a comfortable bra and you'll be very okay. You can even go to bed with your bra. You can wear a different bra in the daytime. You can wear a different bra at night, provided it's comfy and doesn't make you lose your breath. That is the way to go about it. But if you let your breast go, it will definitely give way. I know it's uncomfortable as it is right now. I mean, your breast is tender. You don't want anybody to touch it. In fact, if somebody's breeze passes by you and you feel uncomfortable, you tend to protect yourself. But you have to be strong enough, because like I read in a particular article, beauty is pain. Well, I don't intend for you to get yourself into extra discomfort, but if you can talk to yourself, here, I'm going to wear a bra, and I'm going to wear a bra, and I'm going to make it comfortable, and I'm going to love my bra. How to know a good maternity bra? Number one, you should have a broad band below the breast. You have to ensure that. There are different kind of designs you have in the market, but you're talking about a maternity bra. We're not doing anything about a fashion bra right now. Make sure your bra has a broad band that can hold you firmly, and it's easy to expand as your baby bump is increasing, because you're going to get bigger on the chest area, and you need something that is adjustable at the back and not something here, because if you have a bra that is adjustable here, it's going to keep rising at the back area. So you have to be as comfortable as possible. Your bra should have a broad shoulder strap. They shouldn't be cutting into your skin. You know, there are cases where you have a tiny bra strap, and especially women on the bigger side, you have it cutting into their shoulder. If you have a bra that looks like that is as broad as, let's say, a singlet or a vest, let me not use camisole, because camisoles have tiny straps. Something like a vest, you know, that is broad enough, it's going to make you comfortable. It's going to give you support here, and you get support down here, especially when your band is broad. So you don't want something cutting through your skin. And you may need to get support bras, not one, support bras, as you get along in pregnancy. So you may consider a support bra during the day, you know, wearing something that is so comfy during the day and go about your thing, and then you wear your maternity bra at night. So that will help you reduce sagging. So there are no two ways about it. There are no two ways about it. It's going to reduce it, but your breast will not remain the same. So tips for you in week 10. Number one, you'll be experiencing mood swings, and 1 minute you're happy, the other minute you're sad. During my days, anything can just make me sad, and I just start crying, and I don't know what's making me cry, and the other minute I'm okay. So it all depends on you. How does it happen with you? So how do you handle mood swing? There's nothing you can do about it, apart from the fact that you have to keep making yourself happy. And funny enough, what somebody else does to make you happy might just make you angry, or might just make you sad. So you have to keep managing it. It's going to last for this period, this first trimester, and afterwards you get better, but it's going to come back later. Towards the end of your pregnancy, it's going to come back. So it's something that you have to accommodate and use your wisdom. You know, there are times whereby you perceive a thing that on a normal day you would have accommodated, and you just cannot stand it. Some perfume, some spices, some food. Say for instance, a scent candle, your perfume, your soap, spices, the kind of stew you like to cook and all that. They might be very okay to you in the beginning, but once you get pregnant, sometimes it depends on the individual, you might not be able to tolerate them. Please, if you do not tolerate them, don't beat yourself, just stay away from them. Mangoes. If you can lay your hands on mangoes, get lots of them. Mangoes are rich in vitamin A and vitamin C, and they are very good for both the mother and the child. If you check, some cultures will not do anything without mangoes once a woman is pregnant. It's not coincidence. Mangoes are packed with potassium, and it's extremely good for both the mother and the child. Do your best possible to eat a healthy breakfast. It's always recommended to eat oats and eggs, and then you complement it with other things, because the egg itself is rich in protein. The oats is also rich in protein, but also has fiber. So you have protein, other minerals plus fiber, and then you can complement it with other kind of food fruits, veggies, nuts, and so on. If you have a morning sickness, please do not leave oat out of your food because it has vitamin B, iron, and it contains fiber, like I said earlier, and it is very essential for you. Then egg, on the other hand, has omega-3, it is proteinous, and it's packed with a lot of nutrients. And if you notice, the egg itself is just like the beginning of life. What do you think? So it's packed with a lot of nutrients, which is essential for you and your baby. Oh, I haven't told you, at week 10, your doctor prefers to call your baby a fetus rather than an embryo. So your baby has graduated. So what happens to you at week 10? You notice visible veins on your breast and your abdomen. It's perfectly normal. It's just the blood vessels that keep pumping blood to your heart, because at this point you have to share your blood, the oxygen, your strength with your baby. So more of this activity is going to go on, and your hormones are responsible for this. Constipation is common in first trimester, but there's something I do. I like to take cucumbers, but if you are finding it difficult to digest them, especially the back of the cucumber, which is a little bit harder, you can actually peel it off, but make a smoothie or a juice or whatever. Eat it just like that, the cucumber along with the seed. But if you can tolerate the back, why not? Wash it properly with salt and running water actually. Then you can go about eating your cucumber. So your cucumber shouldn't be far from you. Your breast, on the other hand, becomes bigger and tender. We said that earlier. And your uterus becomes the size of a small grapefruit. Let's just say something as small as this. Small grapefruit. So what happens to your baby? Your baby's bones and cartilage are forming, and the small indentations around the leg will form the knee and the ankle. The placenta begins to take hormonal control of the pregnancy from the 10th to 14th week of pregnancy. The corpus luteum is an area of tissue that forms in the ovary after the ovulation. The toothbud fairy is making an entrance. Your baby's teeth is beginning to settle under the gum, and your baby's stomach is beginning to produce digestive acids. So many miracles that happen as far as pregnancy is concerned, and we are so lucky and we are so blessed to be mothers. So that'll be all for week 10. Looking forward to seeing you in week 11. Subscribe, like, and share. See you in week 11.